One of the things that we strive to do in our practice is enhance our communication skills with our patients. And more specifically, we're talking here about our new patients. In our practice, the initial meeting that we may have with a patient and their parents, we actually refer to it as a consultation appointment. And basically what we're trying to do in a consultation appointment is determine whether or not a younger patient is on a better path of dental facial development or possibly on a bad path of dental facial development. The patients that have all of their permanent teeth, do they have a good occlusion or do they have a malocclusion? And if in fact we see patients that have a malocclusion or are on a bad path of dental facial development, we're typically recommending orthodontic records, because it's not until you take orthodontic records that you're going to be able to do that comprehensive diagnosis and a treatment plan and discuss a more definitive approach to treating the problem, identifying what the problems are, and designing a treatment plan that's going to treat that patient to ideal skeletal and dental relations, and again, treat all contributing factors to poor dental facial development. So the initial appointment in our practice is typically called a consultation appointment, and we explain an awful lot in that appointment about what a patient's going to be going through leading up to treatment. But orthodontic records are required if we want to sit down in a treatment conference, and this is what a treatment conference is sitting down and looking at the orthodontic records and talking about the diagnosis and treatment alternatives. And that way, when a patient goes on to orthodontic treatment, they have a good understanding of what's wrong, why we might be treating this case, why we might be treating it early, what's the goal and the objective of the treatment, whether it's phase 1 treatment or phase 2 treatment. What's the goal and the objective? And after this a comprehensive approach to diagnosis and treatment planning in a thorough discussion, patients are able to, and their parents are able to, make good decisions about whether or not they want to start their orthodontic treatment. And again, we always have good goals and objectives in mind.